mission of Bristol-Myers Squibb R&D is to develop medicines that make a difference for patients with serious disease. It's very important to know that we're dedicated to looking at diseases that have a high unmet medical need. We believe that fibrosis is an important area of investigation. If you think back just in the past 5 to 6 years, our understanding of the biology of fibrosis, fibrosis of the lung, fibrosis of the liver, fibrosis of the kidney, has increased dramatically. Our goal at Bristol-Myers Squibb in liver fibrosis research is to try to determine, can we develop agents that can interrupt the fibrotic process? Can we develop agents that can approach and treat patients who have nonalcoholic steatohepatitis?
Bristol-Myers Squibb is uniquely positioned where we've made investments in our translational medicine efforts, looking for both circulating biomarkers as well as imaging answers, and also with our focus on patients with advanced fibrosis.
Nash is known as nonalcoholic steatohepatitis, and it's really defined as the accumulation of fat as well as inflammation and hepatocellular damage in the liver. It's a condition that is associated with liver damage, and as patients continue to have Nash, they can develop fibrosis, which is an eventual scarring of the liver. Fibrosis is characterized by the accumulation of collagen within the liver, and as this collagen accumulates, fibrosis progresses, and ultimately patients can develop a condition known as cirrhosis, which is really an end-stage liver disease. Once patients develop cirrhosis, they're at much greater risk for liver disease-related complications, as well as hepatocellular carcinoma and liver-related death.
It's predicted by the year 2020 that nonalcoholic steatohepatitis will overtake hepatitis C virus as the #1 cause for liver transplant. That's an important fact for us to keep in mind, because the efforts that are underway today in research and development here at Bristol-Myers Squibb and in the field itself will hopefully be able to impact the number of patients who progress to the point where they need a liver transplant.
Nash, when it's associated with the development of advanced fibrosis, puts patients at clearly increased risk of liver disease and liver-related mortality. Some of the liver complications of Nash can include bleeding from the esophagus or from the stomach. It can also include development of fluid in the abdomen or in the rest of the body, that's known as ascites. Some patients will go on to develop hepatocellular carcinoma, and some patients only have a recourse of liver transplantation.
Here at Bristol-Myers Squibb, we're committed to our efforts in translational medicine. There's a lot of efforts underway in both discovery and in development to figure out how we leverage biomarkers to find patients who are at risk of disease, and then also to assess how they're responding to therapy.
At Bristol-Myers Squibb, we believe that collaboration with our academic partners is crucial to our success. We know that the insights into the disease process happens with physicians who are taking care of patients and scientists who are working in the laboratory.
Here at Bristol-Myers Squibb, there's a team of scientists who come to work each day looking for answers for patients with advanced fibrosis. Nash is a complicated and heterogeneous disease, and the more we can leverage the thinking broadly with our partners, the hope is we will find answers for patients with the highest unmet need.
Bristol-Myers Squibb is committed to developing drugs for patients who have fibrotic diseases. And so we think this is an important part of meeting a very critical unmet medical need.